Hey everyone, this is Kyla Franks from the Tennessee Justice Center. We're going to get started in about 1 minute. I want to make sure that everyone on the call can hear me, so I'm doing a quick sound check. There should be a question box on the side of your computer if you're logged in on a computer. If you could type into that question box that you can hear me, that would be great. Thank you so much. Great, it sounds like everyone can hear me. If at any point you can't hear the audio cuts out or the visual cuts out, please just let me know. If you're on a computer, you should be able to see the screen on the front. We'll go ahead and get started. We're excited to have you guys on the call tonight and on the webinar. My name is Kyla Franks. I'm the field director at the Tennessee Justice Center, and I'm looking forward to talking with you all this evening about the Bring It Home campaign to bring home dollars, jobs, and healthcare back here to Tennessee. This webinar is going to be 1 hour long, and we're going to have time for answering questions at the end, most likely. But you can feel free to type your question into the question box at any time. So if you're on a computer, there's a thing on the side where it has a question box. Just type your question there, and then we'll get to questions at the end. And if we don't have time to answer them, we can also send out a question and answer in the follow-up email after this webinar. Just so you all know, this webinar is being recorded, so you'll receive the recording after the webinar as well as a slide deck with all of the PowerPoint slides. We'll be able to share all of that with you afterwards, so don't worry if you miss something and want to see it again. So as I mentioned today, I'm with the Tennessee Justice Center. So what does the Tennessee Justice Center do? We do several different things. We help clients one-on-one. We help clients who maybe are eligible for TennCare or looking to receive eligible benefits from TennCare, and we help them to be able to get the services that they're available for, the basic necessities of life. We also provide training about public health insurance programs and about nutrition as well. And we advocate for Tennesseans. Our goal is to make sure that Tennessee is a state in which everyone thrives, and we make sure to advocate for Tennesseans and the basic necessities of life and bringing them here to Tennessee. So you all know the Tennessee Justice Center is a nonpartisan, nonprofit organization. So what we're talking about tonight is only issues related to healthcare coverage and not to party politics. So tonight, like I said, we're talking about the Bring It Home campaign. I'm really excited to be introducing this to you all. Some of you on this call may already have been working on bringing home our federal tax dollars from Medicaid expansion. And if you're new to the issue, we hope this provides an overview. And if you know a little bit more about it, we hope that this answers questions about where we're at right now and what more can be done. So the Bring It Home campaign is a nonpartisan effort by organizations and individuals to educate Tennesseans and policymakers about the need to make full use of federal health care funding to address Tennessee's most urgent and pressing health care needs. So we're looking at bringing home our dollars, our federal tax dollars, bringing home jobs, and bringing home our health care. So that's what this is all about here in Tennessee, to bring home federal health care funding that would expand Medicaid here and address a lot of our urgent health care needs. So tonight, we'll cover a couple different things. For anyone who's a little bit newer to this and wants to learn some more, we'll go over what is Medicaid, what is TennCare, what does that mean for Tennessee, and kind of give that overview of how important this is for our state and what it would mean to bring in more funding for our state budget. We'll also talk about Medicaid expansion, a little bit about the background for previous efforts to expand Medicaid in Tennessee and where that's at right now. We'll also go into the political environment. What's the possibility for this right now? Where are we going and what's the possibility for moving forward and what's the time frame? We're also going to explain how this impacts all of us. The case for Medicaid expansion here in Tennessee is not just, for advocating for people who are currently uninsured to get health coverage. We'll go into some of the reasons why everyone in the state would benefit if Tennessee expanded healthcare coverage, with our healthcare infrastructure, creating jobs, making sure coverage is affordable for all of us, even if we're not on TennCare. And finally, we'll go into the path forward. What can we do now, and what are some things that people on the call could think about? All right, so getting started, what is TennCare? So Medicaid in Tennessee is called TennCare. This is Tennessee's safety net for people who need healthcare coverage and are below a certain income threshold and meet a certain category, such as being a pregnant woman, a parent of a minor child, a child themselves. And Medicaid is actually the largest health insurer in the entire United States. More than Medicare, more than any one private insurer, Medicaid, or TennCare in Tennessee, is the largest health insurer in the entire United States. So, little known fact. It covers vulnerable people primarily, so people with disabilities, but it's important to remember it covers healthy people as well, primarily children. There's about 1.5 million people who are enrolled in TennCare, and that's half of all of Tennessee's children are covered by TennCare. Half of babies born in Tennessee are covered by TennCare. And because of that vital funding for our children and for our babies, it provides really needed funding for the state's network of neonatal intensive care units. So these neonatal intensive care units that benefit everyone, for anyone who has a high-risk pregnancy, no matter what type of insurance that you have, they rely on TennCare in order to be able to function, to get the necessary funding that they need. So again, why this would impact all of us in terms of, the importance of Medicaid and TennCare. This is a federal-state partnership. I meant to mention that a second ago. That means that the federal government would pay a certain amount of the funding, about 2/3, and the state would pay the rest. So it's both federally and state funded. TennCare also, it covers 2/3 of long-term care for frail older adults. So those are going to be people who are in nursing homes or receiving nursing home level of care at home. Another really important thing to realize is that $1 in every $5 in our state budget is federal Medicaid dollars. So 20 cents of every dollar, actually a little bit more than that, nearly a quarter of our state budget is federal Medicaid dollars. And that's important. That's important to remember why all of us, TennCare and federal Medicaid funding and this federal funding really impacts all of us. So when that much of our state budget comes from federal Medicaid dollars, that means that it frees up other money to pay for higher education, K through 12, public safety. And these dollars really play a huge role in our state budget in making Tennessee be able to thrive. It's also the foundation for rural health. So rural county populations are much more heavily reliant on Medicaid than cities. So by funding coverage for rural Tennesseans, Medicaid is also funding the healthcare system by which rural Tennesseans are able to thrive. So another little known fact. Can everyone still hear me? Someone just was wondering if the sound cut off. If anyone else can hear me or cannot hear me, just type into the question box if you can hear me, just so I know if this is one person or if it's, okay. So for the person whose sound just cut off, I hope you can re-register or re-sign in. All right, great, good. Glad the rest of you guys can still hear. We're just gonna make sure, because I didn't want you guys just to be hanging on the line wondering what happened. All right, so getting back into it. So what is Medicaid expansion? It's an option for the state to expand coverage to people who are now uninsured. And so if we were able to expand coverage to people who are now uninsured, what that would mean is that more funding would come into Tennessee. This would stimulate jobs, and it would provide a needed healthcare coverage for our neighbors in helping support our healthcare infrastructure. So that's why Bring It Home means we're going to bring in federal dollars that would help expand Medicaid, the jobs that would stimulate, and the healthcare coverage that's needed to support our infrastructure and to help our neighbors. So we'll get into all of that a little bit more, but that's the overall structure of what Medicaid expansion would be. So a little bit of background. Why hasn't Tennessee expanded Medicaid and joined the 31 other states that already have, the majority of states? So there's a little bit of history that I'll go through that maybe some of you guys know, but I want to give background for those who don't. So Medicaid expansion became an option under the Affordable Care Act. And then in 2014, the Supreme Court said that Medicaid expansion would be up to individual states. Individual states would be able to decide whether they would expand Medicaid or not. Around that time, Jeremy Durham, who was in the Tennessee legislature, had a bill that was passed into law that said that Medicaid expansion could only happen with the legislature's approval. So the governor couldn't decide to do it on his own. There would have to be the legislature to approve Medicaid expansion here in Tennessee. So that's important to remember for Tennessee's specific landscape. Durham's law means that it's really vital to inform and involve the legislature in the process of expanding Medicaid. We cannot just do it with the governor. Jeremy Durham was actually subsequently ejected from the state legislature for misconduct, but the law stays on. Then Governor Haslam proposed Insure Tennessee in 2015. So this was a conservative alternative to Medicaid expansion. Governor Haslam was very concerned about the financial welfare and overall health welfare of the families, the 300,000 Tennesseans who are in the coverage gap, meaning they have no access to health insurance. So that's why he came up with this conservative alternative to Medicaid expansion. So people could either opt for TennCare or they could buy into their employer's plan. So there's some unique Tennessee provisions in that. And these unique Tennessee provisions would distinguish it from just traditional Medicaid or TennCare. But it would use, even though it's a conservative alternative, it would use federal money, the federal money on the table. And that federal money on the table is funding for 90% of the Medicaid expansion costs. So that's what the funding is that we're leaving on the table, is that there's the federal government is willing to pay is willing to pay 90%, not up to, just 90% of federal expansion costs. And then under the governor's Insure Tennessee proposal, the other 10% of the funding for Medicaid expansion will be paid by the hospital assessment, essentially a tax. So that means that Medicaid expansion would have been free for Tennesseans, and it wouldn't have added a dime to state taxes. So that's really important to remember. And the governor had called a special session of the legislature in 2015, because, as I mentioned, because of Durham's law, he couldn't move forward without the legislature's approval. Despite Insure Tennessee being popular, it was polling really high, it was defeated in the special session of the legislature. And after that, there was an enormous backlash against the legislature, op-eds, editorials, people wondering what happened, people who support Governor Haslam, people who wanted this federal money to address Tennessee's needs and cover the uninsured in our state and help our healthcare infrastructure. There was a huge backlash against that, the failure of Insure Tennessee. And because of that enormous backlash against the legislature, Speaker Harwell called the 3-Star Healthy Task Force. And this was chaired by Cameron Sexton of Crossville. And they came up with a proposal that would be another conservative alternative to Medicaid expansion. And the priority for the 3-Star Healthy Task Force was to, in the first year, provide coverage to the 24,000 veterans who are in the coverage gap that have no access to insurance. And in that first year, they would provide health coverage to people with behavioral health issues, people with addiction issues, people with mental health issues. So the first year would be providing that coverage for those people. And if that went well in that trial period, then they would expand the coverage to everyone else. So that was in the summer of 2016 when that first came out. So then in the end of 2016 and 2017 and 2018, there was a lack of motivation for moving forward on the three-star task force plan, because in 2017, there was a strong feeling of needing to know what was going to happen at the federal level, what's going to happen in Washington. There was a lot of discussion of the Affordable Care Act being repealed, which would take away the funding mechanism for Medicaid expansion. And so in 2017, a lot of the three-star recommendations were tabled. But as you all know, the Affordable Care Act was not repealed, and it commands the support of a majority of Americans, and it certainly won't be repealed this year, and it seems like it'll be with us for a while. Even opponents of the Affordable Care Act have been conceding that it seems that the Affordable Care Act is here to stay and is the law of the land. So it's been interesting seeing now, since the federal debates have subsided, it seems that the ACA is here to stay. There's been a lot of renewed interest among a lot of states for Medicaid expansion and not leaving the federal money on the table, including comments from Governor Haslam. There was a news story that broke that was a leaked backdoor meeting in which Governor Haslam met with legislative leaders and asked, can we expand Medicaid? Would you support expanding Medicaid? And there were interesting things that came out of that article about Speaker Harwell, Lieutenant Governor McNally saying that they were open to it. It did not end up going anywhere this year, and that's why we are moving forward to talk, but what we can do now. So I went over a lot of this a minute ago, but as I said, House Speaker Ryan said the Affordable Care Act is the law of the land, and Tennessee stands greatly to benefit from expansion. Governor Haslam, the business community, healthcare providers, we have years of experience and research that show that states that have expanded have done better in a number of measures. There's been a large scale, natural experiment going on in our country between states that have expanded and states that haven't. And these years of experience and research show that in a number of measures, the 31 states that have expanded have done better. And the renewed interest here in Tennessee shows that the tides are turning here. This is, a tipping point here in Tennessee. There was a Vanderbilt poll that was conducted at the end of last year that showed that healthcare was among top voter concerns, along with the economy. And there was a poll that was done recently in April of 2018, which shows that the vast majority of Tennesseans support Medicaid expansion. So Mason-Dixon, a respectable impartial polling center based in Atlanta, had a poll that came out, and I'll send this slide deck to everyone so you can click on this link and read more about it. But it showed that 63% of Tennesseans supported expansion and only 21% opposed. And as people went through the poll and got more education about, what expansion would mean for our rural hospitals, for the opioid epidemic, for rising insurance premiums, all things I'll discuss in a minute, people were much more apt to support it, and the numbers went even higher, which shows that once people understand what this means for our state, they are much more likely to be in support. And it's been increasingly understood that there are broad benefits to expanding coverage. And it would address the practical problems in our state. So Governor Haslam, he had a particular concern for the uninsured working families who are still struggling and still have no access to health coverage. And this is vitally important to ensure that, all Tennesseans have the ability to thrive. But it's much more than that as well. There's been years of research and data shows that this impacts all of us. People in rural areas are concerned about their rural hospital closing. In fact, in that Vanderbilt poll that I just mentioned, 80% of respondents were concerned about rural health and concerned about the impact of hospital closings, over 80%, and the danger that those would pose. And in fact, Medicaid expansion shows that it would help address some of those practical problems that people are facing, because hospitals in expansion states or hospitals in non-expansion states are 6 times more likely to close than hospitals in expansion states. And so what are some other of these practical problems? Jobs that have been foregone. There would be, $1.4 billion a year in federal healthcare funding that we're leaving on the table right now. If we accepted that those federal Medicaid dollars, which, we are paying taxes right now. Those taxes are going to DC. Just because we're a non-expansion state doesn't mean we're paying any less taxes. We're paying the same taxes as Kentucky, which did expand Medicaid and is, receiving federal healthcare funding back. But we are not accepting the $1.4 billion a year. And that means that, if we were able to bring that money in, we'd be able to generate jobs. Right now, those jobs are foregone. There's also existing jobs that are at threat. As I mentioned, hospitals in non-expansion states are 6 times more likely to close. So those over 24 hospitals in our state, primarily in rural areas, are very financially at risk. They've been losing money. And if we want to help preserve these rural hospitals and urban hospitals as well, then bringing home our federal tax dollars is the best way to do that. And the people who are employed by those hospitals, if they're at risk of closing, their jobs are at risk as well. There's 13,500 people employed by these hospitals that are at risk. And there's also clinics, pharmacies, other health providers, especially in rural areas, that would benefit greatly. And if the federal money was brought back in, but right now the jobs are at threat with our rural healthcare infrastructure being at threat. In terms of healthcare expenses, there's so many people who are uninsured, about 300,000. And when they go to get coverage, many are bankrupt trying to pay for their health coverage, and medical debt is the leading cause of bankruptcy here in Tennessee. And then they still can't even afford it, even if they're trying to go bankrupt to pay these costs. So what that means for people who aren't on TennCare is that the cost is then shifted to the insurance companies. And those insurance companies then are charging higher premiums and higher cost sharing for the people who are insured in order to make up for the uncompensated care for the people who are uninsured. What that amounts to is about, there's been a report that shows that it's about $1,000 per person is those per capita costs that we all share for people who are insured in order to pay for the uncompensated care of people who are uninsured. And those pressures of uncompensated care, they restrict insurers to restrict health coverage in ways that impact people with pre-existing conditions as well. There's a lot of discussion about concern for people with pre-existing conditions in the health debates last year. It's important to realize that this is tied up in that debate as well. I mentioned our rural healthcare infrastructure earlier, but also one thing that's impacting rural and urban alike is the opioid epidemic here in Tennessee. And there's been a lot of concerns about that among our elected officials and among regular Tennesseans. We know that overdoses now kill more people than auto accidents. And it's important to remember that Medicaid, or TennCare, is the largest purchaser of treatment and prevention. So Tennessee is not taking full advantage of that right now. And that is a real tragedy that we're not taking full advantage of all the benefits on the table for prevention and for treatment in order to address this devastating epidemic here in Tennessee. I want to quickly go through some of the arguments that people have come up with in the past, but now just don't hold up to evidence. An argument that we heard strongly and loudly in 2014 was that Medicaid expansion was authorized by Obamacare, and we shouldn't have anything to do with Obamacare or the Obama administration. Well, we now have a new administration, and the Trump administration has put its own stamp on expansion. It's granted waivers for Medicaid programs to do things that Insure Tennessee would have done. And so there's new administration in the House, and they're having their own unique stamp on expansion. So that argument doesn't hold up to evidence any longer. The Affordable Care Act has not been repealed last year. It's certainly not going to be repealed this year, and it's unlikely to happen in the future. Like I said, even the opponents of the Affordable Care Act concede that. So every day that we don't expand, waiting to see whether the ACA will be repealed, we're going to be losing out on $3.8 million. Every single day, we're losing out on that $3.8 million. And those are funds that are earmarked for Tennessee. This is not also a zero-sum game. So this isn't, something where it would be zero-sum. It's a win-win game for everyone. The healthcare effects, the healthcare system would positively benefit, and the fiscal effects would be positive. it would drive up state revenue, and the money that would be coming into Tennessee, like I said, this $3.8 million a day, that goes into our economy, that then generates sales tax revenue. This is a net positive effect for our budget, and it would keep generating additional revenues. Some people have also pointed to TennCare's experience in 2005 during the TennCare cuts. In 2005, we were talking about a federal share of Medicaid dollars that was only 65% of the cost. And now with Medicaid expansion, we're talking about the federal government covering 90% of the cost, and then the hospitals picking up the other 10%. So I mentioned this briefly, but under Insure Tennessee and any proposal that would be here in Tennessee, the hospitals would, through the hospital assessment, essentially a tax, would pick up the other 10% that the federal government would not pay. So that means that it would only be a positive impact on our state budget, not a negative one. So it's important to keep in mind that if the federal government's paying 90%, the hospitals are paying 10%, there's not a financial crisis on our state budget. It would be a net positive impact on our state budget. We've also been hearing from candidates that maybe holding off for a block grant, and we want a certain amount of funding given to Tennessee that we can spend how we want. There are pros and cons to block grants, but it's important to remember that important consumer protections would be gone if we did have a block grant. But reasonable people can disagree about the merits of block grants, but truth to tell, that's a moot point. It's all just an academic debate. Because of what happened in Congress last year, block grants cannot happen. The Trump administration has been telling other states, most recently Kansas, they cannot give the states the money and have them do with it what they please. They can't give block grants because that did not pass in Congress last year. So that's off the table. If we hold out for block grants, we're continuing to give up $3.8 million every single day in federal health care funding, or $1.4 billion every single year. So just wanted to address that. We've heard that coming from a couple different angles. It is, at this point, a moot point. All right, so what is the benefits of bringing it home? Bringing home our dollars, our jobs, and our healthcare. So this is the number that I wanted to emphasize, is every year we would be bringing in $1.4 billion more of federal healthcare funding that's earmarked for Tennessee that is currently not going to Tennessee. Like I said, we're not paying fewer taxes just because we didn't expand Medicaid. Paying the same taxes, and that funding is going to other states. And it would be a huge economic benefit and a huge vital lifeline in our state budget to be able to bring this much more funding back to Tennessee. And $1.4 billion a year turns into $3.8 million a day, which is another number that I've been saying. Just wanted to emphasize that. There was a study by the University of Tennessee in Knoxville that showed that if we brought in that federal healthcare funding, there would be 15,000 jobs that would be created. And as I mentioned earlier, thousands of jobs would be preserved, most notably in the hospital industry to prevent hospitals from closing, but also in other healthcare industries that may be at risk without us accepting this federal funding that would go into our state. It also shows that the increasing rate of the growth of premiums and increased cost sharing in non-expansion states. So I mentioned earlier the hidden health tax of about $1,000 per person in states that did not expand Medicaid is the estimated cost for all the uncompensated care that insurers will then shift to those who are insured. Federal research also shows that premiums for commercial insurance purchased on the federal insurance marketplace, the healthcare.gov, those premiums are 9% higher in non-expansion states like Tennessee than they are in expansion states like Kentucky. That's because expansion provides federal payment for people whose cost of medical care, if they were uninsured, would largely get added to the bills of insured patients. So by reducing the financial pressure that uncompensated care puts on the private insurance market, Medicaid would help stabilize private insurance, and that's going to lessen the pressure on insurers to cut benefits or eliminate coverage of costly patients or conditions. Again, that's how it's going to help people with pre-existing conditions. And it would also, bringing in this federal healthcare dollars would help the healthcare system for all of us. We, again, mentioned a lot about our rural healthcare infrastructure, which we do want to, keep emphasizing. But again, it's our healthcare system that all of us are going to rely on. As I mentioned earlier, neonatal intensive care units, the hospitals that we're all going to rely on, they stand to benefit from accepting this federal healthcare funding. And it's not just rural hospitals that are at risk. Here in Nashville, we've been paying attention to Nashville General Hospital and that hospital also being at risk. So it's urban hospitals as well as rural hospitals as well. Also, in terms of the addiction crisis, bringing home our federal tax dollars would help all of us. So we've been told by economic development experts that it's difficult to recruit industries to certain areas because there's just not enough people who can pass drug tests. As I mentioned, Medicaid, bringing in this full amount of this funding would provide vital prevention and treatment funds to help address that addiction crisis. And it would help to ensure that our rural hospitals stay open. Again, another way that it would help everyone in rural areas. I also want to talk about the people who are in the coverage gap, the people who can't access insurance at all right now. So there's about 300,000 people who are in the coverage gap who currently have no access to affordable health coverage. And this is estimated from the fiscal note from the Insure Tennessee plan. This is the state government's own estimate. These people can't qualify for Medicaid. It's not because they're not poor enough. They are poor enough. They are below the income threshold. The reason these people who are in the coverage gap cannot qualify for TennCare or for Medicaid is because you have to fit into certain categories in order to get TennCare. You have to be a parent with minor children. You have to be a pregnant woman. You have to be someone with severe disabilities, or you have to be a child or fit into one of the other small categories like breast or cervical cancer. If you don't fit into one of those categories, it doesn't matter your income level. You have no access to health coverage. So a college student with no income who's not on their parents' insurance, they may fall into the coverage gap if they don't make enough, if they're still below the federal poverty line. Someone who, older adult whose child just turns 19 years old, if they don't make enough coverage, as soon as their child would turn 19 years old, they're no longer a parent of a minor child. So all of a sudden they don't fit into a category of TennCare, and then they would, again, no longer be eligible for TennCare. If you're just an ordinary working adult without kids, you're just not qualified for TennCare. When the Affordable Care Act was passed, it was supposed to do away with these categorical restrictions. Everyone should get Medicaid or TennCare under a certain income threshold, and everyone over that income threshold would be able to get coverage through the individual marketplace with subsidies to help with their cost sharing. But as a result of the Supreme Court decision I mentioned earlier, it's now up to the states as to whether they want to expand Medicaid. And that created this situation where if you didn't make enough, which is 100% of the federal poverty level, if you're below that threshold, you can't get subsidies through the individual marketplace or healthcare.gov. Only if you're between 100 and 400% of the federal poverty line can you get subsidies to help with cost sharing on the individual marketplace. So it's those people who are less than 100% of the federal poverty line and don't fit into a category of TennCare who have absolutely no access to coverage. And that, the federal poverty line for an individual is $12,000 a year. So like I said, it's not because they're not poor enough. They're poor enough. It's the categorical restrictions that I get that people may not understand. And that includes 24,000 veterans who are in the coverage gap. 24,000 veterans in Tennessee who have no access to health coverage. And what does it mean for people without coverage? It means that you're one illness or one accident away from bankruptcy, because as I mentioned, uninsured medical debt is the leading cause of bankruptcy in Tennessee. And there's studies that show that in expansion states, the number of bankruptcies has decreased dramatically. And the health effects of not having insurance, as I'm sure you all know, you put off routine visits, you put off checking things out, and there's studies that show that people die sooner from preventable causes, and they suffer unnecessarily from a lack of timely care if they don't have any access to health coverage. I feel like I've emphasized this a lot, but I just want to burn it in everyone's brains. Our rural health communities have really impacted, that would be really impacted if we were able to accept our federal healthcare funding. We've talked about rural hospitals, but I think it's just important to emphasize again how vital Medicaid is to them. If you lose a rural hospital, you're generally not just losing, access to a vital healthcare lifeline, you're losing the first or second largest employer in the community. And if you lose a rural hospital, that makes it harder to recruit industries to an area. Hospitals also are great employers. They usually provide great benefits to employees. So when you lose that hospital, you're losing young people who are going to seek better opportunities elsewhere. That affects our entire rural economic communities, our entire rural communities and their vitality. So there are hospitals that we'll have to transform. We'll need to come up with a new model to make sure that they're economically viable, but they also vitally need funding to make that happen, to be able to even come up with those new models. As I mentioned, if we accepted our federal healthcare funding, it would reduce the rate of hospital closing 6 times. It will be 6 times lower in an expansion state, the fact that a rural hospital would close, or the likelihood that a rural hospital will close. And Tennessee actually has the highest rate of rural hospital closings than any other state. So Texas has more hospitals that have closed, but Texas obviously is a lot larger than we are. Tennessee has the highest rate or number of rural hospitals that have closed per capita than any other state. 8 hospitals have closed in the past 8 years. So it's really important to remember how this would impact our rural communities and how vital this is for them. So that's all great. So now what? How could we do this? So as I mentioned earlier, holding out for a block grant is just a non-starter. It's not going to happen here. As the Trump administration has said that they cannot grant a block grant considering what happened in Congress last year. Something that's happened in other states, such as Maine, voters have gotten together to bypass the legislature to put it on the ballot. If the Tennessee legislature won't do it, let's get the voters together, put it on the ballot ourselves to bypass the legislature. Well, we can't do that here in Tennessee. Our state constitution does not permit the same voter-initiated referendums that other states like Maine have done. The only path forward is through the Tennessee legislature, and only the legislature can repeal Durham's law. So this is vitally important that the Tennessee legislature is where the focus needs to be if we want to make sure that this happens here in Tennessee. So what needs to happen is educating the public about practicalities. People of all types should come together and talk about what this would mean in our local communities, our hospitals, recruiting outside industry, where we're having a hard time recruiting employers, what it would mean for our economy and bringing jobs back. It's not about ideology. It's not about philosophy. We have a lot of practical problems here in Tennessee that's going to be better addressed if we bring in $1.4 billion into our Tennessee budget every single year. Those are the practical problems. So why are we talking about this now? We're in the middle of an election season, as I'm sure you are aware. There are many open seats. All the state representative seats are up, and half of the state Senate seats. And voting in party primaries is in early August. So right now, we're not trying to influence the elections. We're trying to make sure that everyone understands this issue, so that next year, elected officials are prepared to bring our dollars home. Because if you want to influence a politician, you talk to them when they're running for re-election or running for election. This is when they're listening. So this is the issue that we need to talk about. So next year, in 2019, our elected officials are prepared to bring our dollars home. I'll emphasize again, we're not trying to influence the election. We're making sure that everyone in this election season knows that Tennesseans support Medicaid expansion. So how to do this? Educating one-on-one in Sunday schools, civic conversations, talking about how this affects all of us and how these conversations need to be happening. Talking to local organizations that you're a part of, participating in forums and other community conversations. This is something that we want to make sure that everyone is talking about, so that community leaders, outside experts, everyone's coming together to talk about these issues and how it impacts local communities. So calling on everyone to spread the word. If you want more information, again, we'll be sending out the recording of this webinar and also the slides. You can also visit our website, which is on the screen, and you'll be able to click on the link when you get the slides. That will have more information about several of the different topics, more resources, talking points, videos. Please feel free to visit it. And if you have any questions, email us at outreach@tnjustice.org. For anyone who's on the phone and not looking at the screen, I'll repeat that one more time. It's outreach@tnjustice.org. We would love to hear from you, and we'll be following up in an email afterwards. But we do want to make sure that you guys know how to reach us in case you have any questions and want to learn more about how to get more involved or have anything else that we didn't address today that you wanted to learn more about. So with that, I do want to turn it over and see if we have any questions. If you have any questions, please just type them into the question box at this point. We would love to answer anything that you guys are wanting to know, anything that that you heard that you want to learn more about, or any questions overall about the importance of TennCare funding or the progress towards Medicaid expansion that we've made here in our state. I'll give you just a minute to open up the question box and type in your question. All right, I haven't seen any questions coming through yet. Yeah, okay, one question has come through. You said states that have expanded have done better. How? Great, that's a great question, and happy to address that. So a couple things, our rural hospitals is something that, I emphasize. So rural hospitals are 6 times more likely to close in non-expansion states like Tennessee. So in expansion states, rural hospitals and hospitals in general are more likely to stay open. I think that really matters to Tennesseans, especially people we're talking to in West Tennessee and in areas that hospitals have closed, is that they need this federal funding to keep their rural community vital and to keep their hospital open. So expansion states have done better in that. Premiums, as I mentioned, are also lower in expansion states. So going back to something I cited earlier, but the expansion premiums there's been federal research that showed that for commercial insurance purchased on the federal insurance marketplace, those premiums are 9% higher in non-expansion states. So we're going to be facing higher premiums here because of a greater level of uncompensated care. And that's because, all the bills of uninsured patients get then passed on to people who are insured, because it's going back to the federal government, going back to the people who are insured. So those are a couple reasons, but overall, the addiction crisis, as I mentioned, Medicaid is the #1 payer for treatment and prevention. The addiction crisis here in Tennessee has been, as we know, very devastating. And having more funding for treatment and prevention is, very important. And also jobs. So like I said, 15,000 jobs would be created here in Tennessee if we were able to accept the federal healthcare funding if we expanded Medicaid. So if we want 15,000 more jobs and thousands of jobs preserved, that's going to be better here in Tennessee. So those are a couple of reasons, but we are happy to talk more about that if you wanted to ask more about that as well. Thanks for your question, really appreciate it. All right, we got another question. There are some people that get TennCare, but they are not citizens. How can we prevent that? Great question. So we have screening mechanisms. I used to be a client advocate here at TJC, would help people to apply for TennCare. And, there are screenings for people to make sure that they're citizens when people get TennCare. So, or they have an eligible immigration status. So there are already mechanisms in place to make sure that people who, to make sure that people are qualified and eligible for TennCare are the ones who are receiving TennCare. Providing more healthcare funding and more funding to TennCare in our state budget would help to increase all of our processes and all of our administration in order to make sure that it runs most efficiently and that people, who are eligible are able to get TennCare and to be able to screen effectively to make sure that, only citizens or qualified immigrants who are the only people who are eligible under the law are getting TennCare. So thanks for your question. We got another question that says, I do not understand why we would not take the federal money. Why would Haslam be against accepting the Medicaid expansion funding? So Governor Haslam is not against accepting the Medicaid expansion funding. Governor Haslam actually supported it and came up with his conservative alternative to Medicaid expansion so that we could have Medicaid expansion here in Tennessee. And so Governor Haslam pushed for it. He called a special session, and he mentioned recently that it's one of the greatest regrets of his time as governor that we did not expand Medicaid while he was governor, and that did not happen. As I mentioned earlier, there were a couple of reasons that people gave in 2014 as to why they were against Medicaid expansion, and that's why the legislature did end up voting down Ensure Tennessee Governor Haslam's plan. As I mentioned, after they voted it down, there was a strong backlash of op-eds and LTEs and from the public saying angry at the legislature for voting it down, which is why Speaker Harwell then called the 3-star task force, which would have expanded Medicaid, most likely, but for the debates last year about repealing the ACA. So there were arguments that we heard most loudly and strongly in 2014 was that Medicaid expansion was authorized by Obamacare and we shouldn't have anything to do with the Obama administration or Obamacare. But as I mentioned, that argument has lost its ground because we do have a new administration now. It's the Trump administration, and they've put their own stamp on expansion. And they've been granting waivers for conservative alternatives to different things in the Medicaid program and for things that Ensure Tennessee, Governor Haslam's plan, would have done. So we have a new administration in the building. So some of those previous arguments don't hold water right now. Again, there was a concern about the ACA being repealed, but the Affordable Care Act being repealed, which would repeal the mechanism for funding Medicaid expansion. But that's, again, certainly not going to happen this year, unlikely to happen in the future, and even opponents to the Affordable Care Act concede that. So while we're, waiting and sitting on our hands, we're losing out on $3.8 million every single day in federal healthcare funding that could be used to address some of our most urgent healthcare needs. And it's a win-win thing game for everyone. It's win-win. It's our healthcare system would benefit, our economy would benefit. It'd be net positive effects for the budget. There were some concerns about TennCare's experience in 2005 with the 2005 TennCare cuts. But again, as I mentioned, with the federal government paying 90%, the hospitals picking up the other 10%, in this scenario, it would be only a positive impact for our state budget, not a negative one. So again, those are some of the reasons that people were against expanding Medicaid, but a lot of those arguments right now don't hold water, and the tides are turning here in Tennessee as more people understand how this could practically benefit Tennessee and address our problems. So I just wanted to throw those out there. If you still have any questions about that, feel free to type them into the question box. We have another question. Is the $1 in every $5, is that currently, or would it be 9 and 10 after expansion? Great question. So right now in our Tennessee state budget, currently, without expanding Medicaid, $1 in every $5 is federal Medicaid funding. That's not expansion funding. That's just overall federal Medicaid funding for the TennCare program that we're currently operating. So already our state budget, relies on federal Medicaid dollars to be able to provide, education, to free up money for education, for all sorts of other things, to be able to run all of the departments that we vitally need. So right now, that's currently. It wouldn't increase to $9 and $10 after expansion. So it would increase, the overall federal money, federal Medicaid dollars that are coming into our state. But the 9 and 10, what that means is that if we were to accept, if this legislature was to vote to accept federal, to bring home our tax dollars, what that would mean is that if we expanded Medicaid, 90% of the cost of Medicaid expansion will be paid for by the federal government. 90%. It's going to stay that way. 90% is the cost that's going to be paid for by the federal government. The 10% would be paid for by tax or the hospital assessment. So the hospitals would then pick up the 10%. That's how it has been in all of the Medicaid expansion proposals that have come forward, like Insure Tennessee. So if we accepted the federal Medicaid dollars and expanded Medicaid here in Tennessee, it would not cost taxpayers a dime. The federal government would pay 90% and the hospitals would pay 10%. We're currently already paying federal taxes. So we're already paying for these taxes, even though we haven't expanded Medicaid. We're paying these federal taxes. And the money is going then to states that have expanded Medicaid, like Kentucky. If we just expanded Medicaid, we would just be bringing our own federal tax dollars that we're already paying in back here to Tennessee, and it wouldn't cost Tennesseans a dime. I hope that makes sense. And does it take the 1 in 5 out of the budget? No. So the 1 in 5 in our budget, the Tennessee state budget, $1 in every $5 for a state budget is federal Medicaid dollars, just to emphasize overall how much money is, our state budget is relying on federal Medicaid dollars and how vitally important it is for Tennesseans. So it doesn't take it out. It would probably, it would just bring more of federal Medicaid dollars back here into Tennessee. I hope that makes sense. Feel free to keep typing if I'm not explaining it well. I definitely want to make sure that we get that cleared up. We had another question. Okay, got a thumbs up. Thank you so much. Does West Tennessee have a viable means of spreading the word about Bring It Home? Are there key players that need to be notified? Who are they, and are they available to the grassroots group? Great question. We definitely hope that everyone on this call who lives in any part of Tennessee is able to spread the word to their communities. It's really vitally important what people do within their own districts, right? So it's so important when people who are living within a community are able to communicate with elected officials or people who want to be elected officials about how vitally important it is to bring home our federal Medicaid dollars in order to address our most urgent healthcare needs. So West Tennessee, there's people who have cared about this issue for a long time, who are continuing to learn and educate, and I hope that, spreading the word in West Tennessee is a great idea. You can host a local community forum to educate the community and elected officials. And I think right now, as I mentioned, the key players to be notified and to be educated and to make sure that everyone understands are people who want to be elected officials and people who are running in this race. Politicians listen when they're about to be elected or going to be reelected. That's when they're really paying attention to what voters care about. And now that we have the ear of people who want to lead our state, I think it's important to understand, these are the issues that are affecting Tennesseans, and a lot of Tennesseans care about this. Like I said, healthcare is the #1 concern of Tennessee voters, along with the economy, according to that Vanderbilt poll. Healthcare is just vitally important, and 63% of Tennesseans support Medicaid expansion, with only 21% opposed. There's really a vast majority of people who support this and who want this to happen here in Tennessee, and now is the time to be notifying people that, here's why people support it. Here's how the benefits that it would have. And so we hope to stay in touch, and we want to make sure that we're giving, anyone the resources that they need to educate their neighbors, to hold community conversations, to, talk to local organizations about things that they would need in order to educate their community. So great question. We hope to stay in touch and give you whatever resources that you need to make West Tennessee to learn more about this. All right, are there any other questions? If anyone else has something that's burning that they want to be addressed, please just type it into the question box now. All right, will any money pay for medicines? So the money that would be coming in from the federal government would be paying for, ensuring that our TennCare program is covering those 300,000 people who are uninsured. And it would be overall bringing more money into our Tennessee state budget. So that money that's coming into our Tennessee state budget would be able to be used to address our urgent healthcare needs. So bringing in more money could mean more funding for treating and addressing the opioid epidemic, and would be providing vitally needed Medicaid dollars in order to provide health coverage for people who need treatment and prevention services, so they don't have to self-medicate, they don't have to get addicted to opioids. So with the money that is going to be brought in from the federal government, in order to expand the Medicaid program to cover the people who are uninsured and to help our healthcare infrastructure, yes, I'm sure some of the money will pay for medicines, but what the funding is going to be going to, is going to be covering people who don't have access to health coverage, and the extra money will also be paying for, sustaining our rural hospitals, sustaining our healthcare infrastructure, ensuring we have enough money to address the opioid epidemic. And yeah, it's a great follow-up. I know people who have had a stroke because they can't buy medicines. Yes, I think that's really, we've talked to a lot of people who have no access to health coverage, and I appreciate you bringing that up. They have no access to health coverage, and there's medicines that they need, and they need to take them on a routine basis in order to keep up their health in order to prevent something terrible like a stroke happening, and they're foregoing that because they have absolutely no access to health coverage. Again, that's 300,000 Tennesseans who have no access to health coverage, and including 24,000 veterans. And being able to make sure that everyone in Tennessee has health coverage and has the opportunity to thrive and get the medicines that they need is good for all Tennesseans to be able to thrive, and good for our healthcare infrastructure to reduce the level of uncompensated care as well, so that overall our healthcare infrastructure benefits. That's a really important point, and thank you for bringing that up. People who forego necessary treatment and medicines just because they don't have healthcare coverage. So thank you for that. All right, well, we hope that you will all stay in touch. Thank you for joining us today. We put our Facebook, Twitter page on here as well on this final slide. We'll be following up again with an email after this. It'll include the slides, the PowerPoint slides, and also a recording of the webinar so that you can tune in again, listen to it again, share it with anyone, and feel free to reach out, email us if you have any questions. We're happy to talk more, answer any questions that you may have. I hope that you all have a great rest of your night. Thanks for tuning in on your Tuesday evening. But thank you so much, and I look forward to talking to you more soon.